Gentlemen, let me ask you a very honest question. If you are over 50 or 60 and you still experience sexual desire and private self-stimulation, have you ever stopped for a moment and wondered, is this actually healthy for me, or could I be causing some hidden harm without realizing it? If you have had that question, you are certainly not alone. Countless men in their 60s, 70s, and beyond continue to experience this completely natural part of life, yet many quietly carry doubt, embarrassment, or simple confusion about what it means for their health. Some men worry that it could make them weaker. Others wonder whether it affects the prostate, and some even fear that it might eventually interfere with their ability to perform comfortably with a partner. Today, I want to separate the facts from the myths and look at this subject from three important angles: biology, emotional well-being, and practical health. I'm Dr. Rose, a urologist with 9 years of clinical experience, and I want you to stay with me through this entire conversation because understanding what happens inside your body can change the way you think about aging, health, confidence, and even your sense of dignity as a man. And before we get into the medical side, do me a quick favor. If you appreciate clear, straightforward health information without unnecessary confusion, give this video a like. And tell me in the comments where you are watching from, because I genuinely enjoy seeing men from different countries and different generations become part of this growing health community. And if you have not already subscribed, consider doing that as well, so you do not miss our weekly conversations about men's health, vitality, and healthy aging. Now, let's get into the science. Here is the simple truth. Private sexual activity in older men is not automatically harmful, and it is not automatically beneficial either. Think of it as one behavior that can affect different people in different ways, depending on frequency, technique, overall health, and the role it plays in their daily life. That is exactly why this subject can become so confusing. Our culture has sent men mixed messages for generations. Some older medical beliefs suggested that sexual release could drain energy or somehow damage the prostate, while some modern wellness personalities go to the opposite extreme and present it as a solution for almost every health problem. Neither extreme gives you the full picture. Modern medical understanding is much more balanced. There are potential benefits that some older men may experience, but there are also possible drawbacks when the behavior becomes excessive, uncomfortable, compulsive, or starts replacing healthier parts of life. And if your goal is to age with confidence, comfort, and a healthy relationship with your body, you need to understand both sides rather than listening to only one. Over the years, I have had many men in their 60s and 70s quietly approach me after an appointment, lower their voices, and ask a question they were sometimes too embarrassed to bring up during the actual consultation. "Doctor, is it still okay that I do this?" And I always believe these conversations matter. Why? Because the subject can intersect with several areas of men's health, including prostate concerns, erectile function, pelvic health, hormone balance, sleep, stress, and emotional well-being. So today, we are going to have the kind of straightforward conversation that many men need but often never receive. I'll take you through the potential benefits first, and then we will look carefully at the possible risks and warning signs that deserve your attention. By the end, you should have a much clearer understanding of how to approach this part of your life in a healthy, balanced, and guilt-free way. So, let's begin with the first potential benefit. One important area to consider is penile and erectile tissue health. Think about an erection as a type of natural physical activity for the tissues involved. When blood enters the erectile chambers, the surrounding tissue expands, allowing it to receive oxygen and maintain its flexibility. Regular erectile activity may help maintain the normal condition and elasticity of these tissues over time. When erections become very uncommon for long periods, particularly in men who already have vascular disease, diabetes, hormonal changes, or other medical conditions, erectile tissue can gradually become less flexible. That does not mean every man needs to engage in private sexual activity for medical reasons, and it certainly does not mean that doing so can prevent every erectile problem. But maintaining healthy blood flow and normal erectile function is an important part of male urological health. In that sense, regular erectile activity can be viewed as a form of natural maintenance for the tissues involved, especially when it occurs comfortably and without causing pain or injury. The second potential benefit involves the prostate, and this is an area where many men have questions. Some research has found an association between more frequent ejaculation and a lower long-term risk of prostate cancer. One widely discussed study from Harvard researchers reported that men with higher ejaculation frequency had a lower observed risk of developing prostate cancer compared with men reporting lower frequency. However, I want to make something very clear. An association does not prove that ejaculation itself prevents cancer. Prostate cancer is influenced by many factors, including age, genetics, family history, hormonal factors, and overall health. So we should never tell a man that a particular frequency of sexual release will protect him from prostate cancer. What we can say is that ejaculation is a normal function of the male reproductive system, and researchers have proposed several possible explanations for why frequency might be associated with prostate health. One theory is that regular ejaculation may help clear prostate secretions from the ducts, potentially reducing the buildup of certain substances. Think of it less as a guaranteed cleaning process and more as one possible biological mechanism that researchers are still studying. For men over 60, this distinction is especially important because prostate health deserves a broader approach. Regular medical checkups, discussing urinary symptoms with your doctor, understanding your personal risk factors, maintaining a healthy weight, staying physically active, and following appropriate prostate cancer screening recommendations all matter far more than relying on one behavior alone. So, gentlemen, the message here is not that you need to reach a certain number or follow a specific schedule. The message is that normal sexual function can remain a healthy part of life as you age, and there is no medical reason to automatically assume that experiencing sexual desire or private sexual activity after 50, 60, or 70 means something is wrong with you. What matters is how your body responds, whether you experience discomfort, and whether the behavior remains a healthy choice rather than becoming something that interferes with your physical health, relationships, or everyday life. And that brings us to the next important area, because the benefits do not stop with the reproductive system. Your pelvic muscles also play a surprisingly important role in men's health, and understanding them can help you recognize why pelvic function becomes increasingly important as you get older. We'll continue there in part 2. The pelvic floor is one of those parts of the male body that many men rarely think about until something starts going wrong. These muscles sit at the base of the pelvis and help support the bladder, bowel, and reproductive organs, while also contributing to urinary control and sexual function. During sexual climax, these muscles naturally contract in a rhythmic pattern. That activity does not mean that sexual activity alone is enough to strengthen the pelvic floor, but it does involve the same group of muscles that men can also train through specific pelvic floor exercises. And as men get older, maintaining good pelvic muscle function can become increasingly valuable. A stronger and better coordinated pelvic floor may support urinary control, contribute to erectile function, and help a man feel more confident about his body. This is especially relevant for men who notice occasional urinary leakage, reduced pelvic control, or changes following prostate treatment. In those situations, targeted pelvic floor exercises, often called Kegel exercises, can be much more useful than relying on sexual activity itself. So think of this as one piece of a larger picture of pelvic health, rather than a replacement for proper exercise or medical treatment. The fourth potential benefit is related to stress. Sexual climax can temporarily influence several chemicals and hormones involved in relaxation and mood, and many people report feeling calmer afterward. For an older man dealing with work-related pressure, financial responsibilities, family concerns, health worries, or simply the normal stresses that come with aging, moments of relaxation can have real value. When the body moves from a state of tension toward relaxation, stress-related signals can decrease, while chemicals associated with comfort and emotional well-being may increase. This does not mean that private sexual activity is a treatment for chronic anxiety or depression. It should never replace professional help when someone is struggling emotionally. But as one small part of a healthy lifestyle, relaxation can certainly be beneficial. And when you combine that with regular exercise, good nutrition, meaningful social contact, and enough sleep, you create a much stronger foundation for healthy aging. The fifth potential benefit involves the brain and the chemicals that influence how you feel. After sexual climax, the nervous system can release or change the activity of several substances, including dopamine, oxytocin, and endorphins. These chemicals are involved in pleasure, reward, relaxation, bonding, and emotional regulation. That is one reason some men describe feeling calmer, happier, or emotionally lighter afterward. For an older man who lives alone or spends much of his time without regular social interaction, moments of physical comfort may feel particularly meaningful. But again, balance matters. Human beings need real connection, conversation, friendship, affection, and a sense of belonging. No private activity can fully replace those needs. So if you are feeling lonely, do not assume that simply repeating the behavior will solve the deeper problem. Sometimes what the body is asking for is not only physical stimulation, but genuine human connection. Reach out to family members, maintain friendships, join community activities, exercise with other people, or simply make time for regular conversations. Your emotional health is just as important as your physical health. The sixth potential benefit is something I often find particularly interesting from a urological perspective: body awareness. When you remain familiar with your own body, you may become more likely to notice changes that would otherwise be ignored. You might recognize a new lump, an unusual area of tenderness, a change in sensitivity, a new curvature, or another difference that was not present before. That awareness can encourage you to seek medical advice earlier rather than waiting for a problem to become more serious. But I want to emphasize an important point. You should never assume that every unusual change is harmless simply because it does not hurt. Some important conditions can develop without obvious pain. If you notice a new lump in the testicle, persistent pain, swelling, a significant change in shape, a new curvature that causes difficulty, blood in the urine or semen, or any other unusual symptom that persists, speak with a qualified healthcare professional. Knowing your normal baseline is useful, but self-observation is not a substitute for a medical examination. The seventh potential benefit is sleep. Many people experience a feeling of physical relaxation and sleepiness after sexual climax, and there are biological reasons for that response. Changes involving oxytocin, prolactin, and the body's stress systems may contribute to the calm sensation that some people experience afterward. For older adults, quality sleep becomes particularly important because sleep affects almost every major system in the body. Poor sleep can influence mood, concentration, blood pressure, metabolism, immune function, and even sexual health. So if a healthy relaxation routine helps you settle down before bed, that can be useful. But once again, we need to keep expectations realistic. If you have persistent insomnia, loud snoring, repeated nighttime awakenings, or severe daytime fatigue, do not simply assume the solution is sexual activity. Conditions such as sleep apnea, medication effects, anxiety, depression, and other medical problems may require proper evaluation. The eighth potential benefit brings us back to circulation. Healthy blood flow is essential for normal erectile function and for the health of the tissues throughout the pelvis. The penis, prostate, bladder, and surrounding muscles all depend on an adequate blood supply. Sexual arousal naturally increases blood flow to the genital region, but that does not mean masturbation can prevent vascular disease or eliminate inflammation by itself. The most powerful ways to protect circulation as you age remain the basics: regular physical activity, maintaining a healthy weight, controlling blood pressure, managing blood sugar, avoiding tobacco, and keeping cholesterol at appropriate levels. For men experiencing erectile changes, this point is especially important because erectile difficulties can sometimes be an early sign of vascular disease. In other words, your sexual health can sometimes provide useful information about your overall cardiovascular health. The ninth potential benefit involves learning better control over your body's responses. Some men experience difficulty reaching or maintaining control during partnered sexual activity, and becoming more aware of the physical signals that happen before climax can sometimes help. Techniques such as the stop-start method are sometimes used in behavioral approaches for premature ejaculation. The basic idea is to recognize the early signs of climax, pause stimulation, allow the intensity to decrease, and then resume when control has improved. For some men, this type of awareness can increase confidence and help them better understand their own responses. However, if premature ejaculation is persistent and causing distress, it is worth speaking with a healthcare professional because effective treatments are available. You do not need to feel embarrassed about discussing it. It is a common sexual health concern, and it can often be addressed successfully. And finally, the 10th potential benefit is simply maintaining a healthy relationship with sexual desire. The brain plays an enormous role in sexual function. Desire involves memories, emotions, hormones, relationships, physical stimulation, and complex networks throughout the nervous system. As men age, libido can naturally change because of testosterone levels, medications, chronic illnesses, relationship circumstances, stress, sleep quality, and many other factors. That does not mean desire has to disappear. There is no expiration date on intimacy, affection, attraction, or the desire to experience pleasure. The goal is not to force yourself to remain sexually active at a certain frequency. The goal is to understand your body and recognize that aging does not automatically mean losing this part of yourself. However, gentlemen, this is where we need to slow down and look at the other side of the conversation. Because even something that is generally considered a normal behavior can become problematic when it is practiced too aggressively, too frequently, or for reasons that begin interfering with your life. The first potential risk is social withdrawal. If private sexual activity gradually becomes a substitute for real human intimacy, a man may begin spending less time with his partner, friends, family, or community. That is where the behavior can become unhealthy. It should fit into your life, not replace the relationships that give your life meaning. The second potential risk involves irritation or small injuries to the skin and sensitive tissues. Using excessive pressure, repeated friction, or an unsuitable technique can cause irritation, soreness, or tiny areas of skin damage. This is especially important for older men because skin can become more sensitive and less resilient with age. If friction causes discomfort, stop and allow the area to recover. A gentle approach is important, and a suitable water-based lubricant can reduce unnecessary friction when appropriate. Pain is not something you should simply push through. If soreness persists, swelling develops, or you notice bleeding or another unusual change, it is time to speak with a healthcare professional. The third potential risk is reduced sensitivity. The nervous system can become accustomed to a very specific type of stimulation when the same pressure, rhythm, or pattern is used repeatedly. For some men, this can make partnered intimacy feel different or less responsive by comparison. That does not mean permanent damage has occurred. It simply means that the brain and nervous system can learn patterns, and sometimes changing those patterns and allowing more variety can help restore flexibility. This is also one reason excessive dependence on highly specific digital sexual content can become a concern for some men. Real-life intimacy is different from what is presented on a screen, and expectations created by unrealistic material can sometimes affect satisfaction or arousal with a partner. So the healthiest approach is to keep your expectations grounded in real life and remain aware of how your habits affect your relationships and your overall well-being. And there is another issue older men should never ignore: erectile dysfunction. If you can achieve an erection during private stimulation but consistently struggle to do so with a partner, do not automatically assume it is simply a psychological problem or something you should ignore. Changes in erections can sometimes be connected to diabetes, high blood pressure, cardiovascular disease, medication effects, low testosterone, nerve problems, or other health conditions. Your sexual function can provide clues about your overall health, so persistent changes deserve attention rather than embarrassment. And that is exactly where we will continue in Part 3 as we examine the remaining potential risks and the practical steps that can help you protect your sexual and urological health as you age. Another potential concern that deserves attention is nerve pressure and pelvic discomfort. Many men never think about their posture when engaging in private sexual activity, but the position of your body can matter, particularly if you spend long periods sitting or placing pressure on the area between the genitals and the anus. There is a nerve called the pudendal nerve that carries important signals through the pelvic region. If this area is repeatedly compressed, especially through prolonged sitting on hard surfaces or awkward positions, some men may experience tingling, numbness, burning, or pelvic discomfort. This does not mean that ordinary sexual activity will damage your nerves. The concern is more relevant when symptoms repeatedly appear after prolonged pressure or when a person continues an activity despite discomfort. If you notice persistent numbness, pelvic pain, changes in sensation, or problems with bladder or sexual function, do not simply ignore those symptoms. A healthcare professional can help determine whether the problem is related to nerves, muscles, circulation, the spine, or another condition entirely. Your body is giving you information, and learning to listen to those signals is one of the most important parts of healthy aging. Another potential risk is emotional escapism. There is nothing wrong with using a private activity as one way to relax occasionally. The concern begins when it becomes your primary method of dealing with stress, boredom, loneliness, sadness, frustration, or anxiety. If every difficult emotion immediately leads to the same behavior, your brain can gradually begin associating that behavior with emotional relief. Over time, that pattern may become difficult to control, especially if you begin using it even when you do not actually want to. This is why I encourage men to develop more than one way of managing stress. Exercise can help. Spending time outdoors can help. Talking with someone you trust can help. Meditation, hobbies, social activities, meaningful work, and adequate sleep can all contribute to emotional balance. Think of your mental health as a toolbox. One coping strategy should not be the only tool inside it. If you find that a particular habit is becoming difficult to control, taking time away from responsibilities, relationships, or activities you once enjoyed, that is a reason to step back and evaluate what is happening. And if you cannot change the pattern on your own, there is no shame in speaking with a qualified mental health professional. The next issue is something that affects many men much more deeply than they realize: guilt and shame. Some men grew up hearing that sexual thoughts or private sexual behavior were dirty, weak, or morally wrong. Those messages can remain in the mind for decades, even when a man intellectually understands that sexual desire is a normal part of human biology. And carrying that shame into your 60s, 70s, or 80s can have a real effect on emotional well-being. You may begin to believe that something is wrong with you simply because you still experience desire. But aging does not automatically erase sexuality. Your body changes, your hormones change, your relationships may change, and your priorities may change, but the capacity for affection, attraction, intimacy, and sexual desire can remain throughout life. There is no reason to punish yourself emotionally for being human. At the same time, removing shame does not mean ignoring unhealthy behavior. A balanced mindset means understanding the difference between a normal private activity and a pattern that is causing physical injury, emotional distress, relationship problems, or loss of control. If guilt has been affecting your self-esteem for years, talking with a therapist or counselor who approaches sexual health in a respectful and non-judgmental way can be extremely helpful. Sometimes changing the way you understand your own body can release a burden that you have been carrying for decades. Now let us discuss another physical issue that some men experience: pelvic or testicular discomfort after repeated sexual activity. When a man engages in repeated stimulation or climax several times within a short period, temporary aching, heaviness, or tenderness can sometimes occur. Usually, this is not a sign of serious damage and improves with rest. But the important word here is temporary. Persistent or severe pain should never simply be blamed on sexual activity. Pain in the testicles or pelvic region can have many possible causes, including infection, inflammation, hernia, kidney stones, prostate problems, or other conditions that need medical attention. If pain is sudden and severe, particularly if one testicle becomes swollen or changes position, seek urgent medical care. Certain testicular emergencies require immediate treatment, and waiting can be dangerous. So please do not assume that every symptom is harmless simply because it occurred after private sexual activity. Your symptoms deserve to be evaluated based on what they actually are. Another consideration is fertility. For men who are not trying to have children, this may not be relevant at all. But if you and your partner are actively trying to conceive, the frequency of ejaculation can temporarily influence the amount and concentration of sperm in a given sample. That does not mean ejaculation every day makes a man infertile. It simply means that sperm concentration can vary depending on the interval between ejaculations. For couples trying to conceive, the best strategy is usually to follow guidance from a fertility specialist rather than relying on a rigid rule found online. Factors such as sperm quality, age, ovulation timing, reproductive health, and the frequency of intercourse all matter. So if conception is taking longer than expected, do not assume the problem is simply how often you release. Both partners may need appropriate evaluation. And now we come to an issue that has become increasingly relevant in the digital age: dependence on highly stimulating online sexual material. There is a major difference between private sexual behavior itself and becoming dependent on increasingly intense or unrealistic digital stimulation. For some men, repeated exposure to highly specific material can create expectations that real-life intimacy cannot realistically match. A screen can be edited, selected, and controlled in ways that real relationships cannot. Real intimacy involves communication, emotional connection, physical differences, patience, and mutual understanding. If a man becomes accustomed to one narrow pattern of stimulation, he may eventually notice that ordinary partnered intimacy feels less exciting or requires more effort to become aroused. That does not happen to everyone, and it is important not to turn a possible risk into a universal claim. But if you notice that digital content is becoming more important than your real relationships, or if you need increasingly specific material to become interested, that is worth taking seriously. Consider reducing your dependence on visual stimulation and allowing your mind and body to respond to real-life intimacy, imagination, affection, and connection. The goal is not fear. The goal is flexibility. Your sexual response should ideally be adaptable rather than dependent on one very specific trigger. Now, after looking at both sides, you may be wondering about the most practical question of all: how often is too often? This is where I want to be very careful, because there is no medically established number that applies to every older man. Some healthy men may engage in private sexual activity several times a week. Others may do it less often, and some may not be interested at all. None of those patterns automatically means something is wrong. Your personal frequency should be judged by how you feel physically and emotionally, whether the behavior interferes with your daily life, and whether it causes problems in your relationships. Instead of asking, "What is the perfect number?" ask yourself better questions. Am I experiencing pain? Am I becoming irritated? Is this interfering with sleep, work, exercise, social life, or my relationship? Do I feel unable to stop when I want to? Am I using it mainly to escape difficult emotions? Are my erections or sexual responses changing in a way that concerns me? Those questions tell you much more about whether your habits are healthy than a specific weekly number ever could. Gentleness is another important principle. Older skin and sensitive tissues may require more care than they did when you were younger. Avoid excessive pressure, avoid continuing when something hurts, and use appropriate lubrication when needed to reduce friction. If discomfort keeps returning, do not simply change the technique and hope the problem disappears. Persistent symptoms deserve a proper evaluation. Awareness is equally important. If you notice new difficulty achieving or maintaining erections, pain, swelling, changes in sensation, urinary problems, blood, or other unusual symptoms, speak with your doctor. Do not use a private habit as a reason to avoid investigating a medical problem. Sometimes what appears to be a sexual issue is actually the first visible sign of a cardiovascular, metabolic, hormonal, neurological, or urological condition. Integration is another key idea. A healthy sex life is broader than one behavior. It can include affection, communication, intimacy, emotional connection, physical touch, partnered experiences, and a comfortable relationship with your own body. Private sexual activity can be one part of that picture, but it should not become the entire picture. And finally, your mindset matters. There is no medical benefit in carrying unnecessary shame. You can approach your body with maturity, respect, and responsibility without judging yourself. At the same time, you should be willing to recognize when something has become uncomfortable, excessive, compulsive, or disruptive. That combination of self-acceptance and self-awareness is what creates a genuinely healthy approach. And in the final part, I want to bring all of this together and explain what I would want every man over 50 to remember when it comes to sexual health, prostate health, and aging with confidence. So, gentlemen, after looking at the potential benefits and the possible concerns, let's bring everything together in a practical way. The most important lesson is that there is no universal rule saying that a man must stop experiencing sexual desire simply because he has reached 50, 60, 70, or even 80. Your age does not automatically switch off your biology. Your hormones may change. Your circulation may change. Your medications may change. Your relationships may change. But the ability to experience attraction, intimacy, pleasure, and sexual interest can remain an entirely normal part of life. What matters is how you respond to those changes and whether your choices continue to support your overall health. One of the biggest mistakes I see is that men sometimes treat sexual health as if it exists in isolation from the rest of the body. It does not. Your sexual function is connected to your cardiovascular system, your nervous system, your hormones, your mental health, your sleep, your medications, your physical activity, and even your emotional relationships. That means a change in sexual function should sometimes be viewed as useful information rather than something embarrassing that needs to be hidden. For example, if you suddenly begin having difficulty achieving or maintaining an erection, do not automatically assume that it is simply a normal consequence of getting older. Age can contribute to changes, but erectile difficulties can also be associated with high blood pressure, diabetes, high cholesterol, vascular disease, low testosterone, certain medications, nerve problems, psychological stress, or other medical conditions. In some men, Erectile changes can appear before obvious symptoms of cardiovascular disease. That is why I encourage you to talk openly with your doctor. A private concern can sometimes provide an important clue about a much bigger health issue. The same principle applies to changes involving the prostate and urinary system. If you notice that you are waking repeatedly during the night to urinate, struggling to start your urinary stream, experiencing a weak stream, feeling that your bladder does not empty completely, or suddenly developing urgency or discomfort, do not simply blame these symptoms on aging. Many of these problems are common in older men, but common does not mean that you have to live with them without evaluation. There are several possible causes, including an enlarged prostate, infection, bladder problems, medications, or other urological conditions. A proper evaluation can help identify what is actually happening and determine whether treatment is appropriate. And when it comes to prostate cancer, please do not fall into the trap of believing that one behavior can guarantee protection. Research can show associations, but no single activity eliminates cancer risk. Your personal risk depends on several factors, including your age, family history, genetics, and overall health. This is why regular conversations with your healthcare provider remain important. Ask what screening approach is appropriate for you based on your individual risk. Do not rely on internet claims that promise a simple number, supplement, food, or behavior that supposedly prevents prostate cancer. Good health is rarely that simple. Now, let's talk about frequency, because this is probably one of the most common questions men have. How often should I do it? The honest answer is that there is no single number that every man over 50 should follow. Some men may feel comfortable engaging in private sexual activity several times per week. Others may prefer much less often. Some may have no interest at all. All of these patterns can be normal. What matters is whether your behavior is causing physical problems or interfering with the rest of your life. Instead of comparing yourself with another man, pay attention to your own body. If you feel comfortable, experience no persistent pain, maintain normal daily functioning, and the behavior does not interfere with your relationships or responsibilities, there may be little reason to worry, simply because your frequency is different from someone else's. But if you are experiencing soreness, irritation, pelvic pain, numbness, changes in sensation, or persistent discomfort, take a break and allow your body time to recover. And if the symptoms continue, get them evaluated. Pain is information. It is not something you should automatically dismiss because the activity itself is considered normal. Another important point is that you do not need to turn sexual health into a competition. More is not automatically better. Less is not automatically healthier. The goal is balance. Your body is not a machine that needs to hit a specific weekly target. Your needs can change throughout your life, and that is perfectly normal. There may be periods when your interest is stronger and periods when it is lower. Illness, stress, relationship changes, medications, sleep, exercise, and hormone levels can all influence desire. The important thing is to understand what is normal for you and recognize when a significant change deserves attention. And please remember something else. Your partner matters too. If you are in a relationship, sexual health is not only about your individual performance. It is also about communication, comfort, trust, affection, and mutual expectations. If you notice that private sexual habits are making partnered intimacy more difficult or less satisfying, that is a reason to adjust your habits rather than becoming frustrated with yourself or your partner. Talk openly. Ask what feels comfortable. Focus on connection rather than performance. Sexual intimacy later in life does not have to look exactly the way it did when you were 25. In fact, many couples discover that intimacy becomes more relaxed and meaningful when they stop treating it as a performance test. You have more life experience. You may understand your body better. You may have a deeper emotional connection with your partner. and you may have learned that intimacy is about much more than achieving one particular physical response. This is also why overall lifestyle matters so much. If you want to protect sexual function as you age, do not focus on one behavior while ignoring the fundamentals. Move your body regularly. Maintain a healthy weight. Eat a balanced diet rich in vegetables, fruits, whole grains, healthy fats, and adequate protein. Keep your blood pressure under control. Manage blood sugar and cholesterol. Avoid tobacco. Limit excessive alcohol. Get enough sleep. And make time for relationships and activities that give your life purpose. These habits support your blood vessels, nerves, hormones, mood, and energy, which all contribute to sexual health. Pelvic floor exercises can also be useful for some men, particularly those dealing with urinary leakage or reduced pelvic control. But if you are unsure whether you are performing them correctly, ask a healthcare professional or pelvic floor physical therapist for guidance. Doing an exercise incorrectly or excessively is not necessarily better. Another issue worth discussing is medication. Many men over 50 take several prescription or over-the-counter medications, and some can influence sexual desire, erections, ejaculation, or urinary function. Blood pressure medications, antidepressants, prostate medications, and other drugs can sometimes contribute to sexual changes. If you notice a new problem after starting or changing a medication, do not stop the medication on your own. Instead, tell your doctor. There may be an alternative treatment or another way to manage the side effect safely. Your doctor cannot help with a problem you are too embarrassed to mention. And believe me, healthcare professionals hear these questions all the time. You are not the first man to ask. You will not be the last. Your sexual health deserves the same level of attention as your blood pressure, cholesterol, joints, and heart health. So, gentlemen, if there is one message I want you to take from this entire conversation, it is this: aging does not make you broken. You do not need to apologize for having a body that still experiences desire. You also do not need to force yourself into a specific pattern just because someone online says it is the secret to staying young. Listen to your body, understand the evidence, watch for changes, and seek professional advice when something does not feel right. That is what responsible, healthy aging looks like. In the final part, I'll give you the simple roadmap I want you to remember, including when sexual activity is generally not a concern, which warning signs should never be ignored, and how to approach this subject without fear, guilt, or unnecessary anxiety. Gentlemen, let me leave you with the most important message from everything we have discussed today. There is nothing shameful about still experiencing sexual desire at 60, 70, or even 80. Your body may not function exactly as it did when you were younger, but that does not mean your sexuality, confidence, dignity, or capacity for intimacy has an expiration date. Healthy aging is not about pretending that certain parts of you no longer exist. It is about understanding how your body changes and learning how to care for it with maturity, awareness, and self-respect. Private sexual activity, when it is comfortable, controlled, and not interfering with your physical health, relationships, or daily responsibilities, can simply be one normal part of life for some men. But you should never feel that you have to follow a particular frequency just because someone online recommends it. There is no magic number that determines whether you are healthy. Two men of the same age can have completely different levels of desire, different medical histories, different relationships, different medications, and completely different patterns of sexual activity, and both can still be perfectly healthy. What matters is how your body responds and whether your habits remain balanced. If there is no persistent pain, no injury, no significant interference with your relationships or responsibilities, and no feeling that you have lost control over the behavior, there may be little reason to feel ashamed or frightened simply because you continue to experience sexual desire. But there are certain warning signs that should never be ignored. If you develop persistent pelvic pain, significant testicular pain or swelling, unexplained bleeding, a new lump, ongoing numbness, severe irritation, or another physical change that does not resolve, speak with a healthcare professional. And if you suddenly notice a major change in your erections, sexual response, urinary function, or libido, do not automatically dismiss it as just aging. Sometimes these changes are connected to conditions that can and should be treated. Diabetes, cardiovascular disease, high blood pressure, hormonal problems, medication side effects, nerve conditions, prostate disorders, and psychological stress can all affect sexual health. The earlier you recognize a meaningful change, the sooner you can investigate what is behind it. And remember, seeking medical advice does not mean something is seriously wrong. It simply means you are taking your health seriously. I also want you to remember the difference between healthy self-awareness and constant anxiety. You do not need to monitor every sensation or worry about every temporary change. Bodies fluctuate, desire changes, erections vary, stress can affect sexual response. Poor sleep can affect libido. Medications can change how you feel. A difficult week does not automatically indicate a disease. What matters is a persistent or significant change, especially when it comes with other symptoms. That is when professional evaluation becomes important. Another principle I want every older man to remember is that sexual health is not only about performance. You are much more than the strength or duration of an erection. Intimacy can involve affection, touch, communication, trust, companionship, emotional closeness, and shared experiences. As you get older, the definition of a satisfying intimate life may naturally evolve. For some men, physical responses may become slower. For others, desire may become less frequent, but more connected to emotional closeness. Some men may experience changes because of prostate treatment, medications, chronic illness, or hormone levels. None of this automatically means that intimacy is over. It simply means you may need to adapt. And adaptation is not failure. It is part of healthy aging. If you have a partner, talk openly about these changes, rather than silently assuming that your partner will understand what you are experiencing. Many relationship problems arise not because intimacy has changed, but because neither person feels comfortable discussing those changes. A calm conversation can remove a tremendous amount of pressure. You do not need to prove anything. You do not need to perform like you did decades ago. You need to communicate, listen, and understand each other's needs. And if erectile difficulties are making intimacy stressful, remember that effective medical treatments are available for many men. A urologist can evaluate the possible causes and discuss appropriate options based on your health. Do not purchase questionable products online or take unverified supplements simply because someone promises to restore your youth. Some products marketed for male enhancement may contain undisclosed ingredients or interact with medications. Your health is too valuable to gamble on a quick solution. The same principle applies to prostate health. Do not rely on a single food, supplement, exercise, or sexual habit to protect your prostate. Instead, take a broader approach. Know your family history. Discuss prostate screening with your doctor when appropriate. Stay physically active. Maintain a healthy weight. Eat a balanced diet. Manage blood pressure, cholesterol, and blood sugar. And report persistent urinary or reproductive symptoms instead of simply accepting them as unavoidable consequences of age. This is what gives you the best chance of maintaining your health over the long term. And if you are struggling with guilt because of messages you heard when you were younger, I want you to hear this clearly. You do not have to spend the rest of your life carrying shame about normal human biology. You can acknowledge your values while also understanding the medical facts. You can make responsible choices without judging yourself. And if shame has become deeply connected to anxiety, relationships, or self-esteem, speaking with a qualified counselor can help you work through those feelings. There is strength in asking for help. There is strength in learning. And there is strength in being honest about your health. So, what is the real takeaway from our conversation? Sexual activity in older men is not automatically good, and it is not automatically bad. The context matters. Your physical condition matters. Your emotional well-being matters. Your relationships matter. And most importantly, your ability to remain in control of your choices matters. When approached with moderation, comfort, awareness, and a healthy mindset, it can be a normal part of life for many older men. But when it causes pain, injury, emotional distress, relationship problems, or becomes difficult to control, that is when you should step back and reassess. Do not allow internet myths to make decisions for you. Do not allow embarrassment to prevent you from seeing a doctor. And do not allow your age to convince you that you are no longer entitled to intimacy, affection, confidence, or joy. Your body deserves care at every stage of life. Your prostate deserves attention. Your cardiovascular health deserves attention. Your mental health deserves attention. And your sexual health deserves attention too. Gentlemen, if this conversation helped you understand your body a little better, I would love to hear from you in the comments. What was the most surprising thing you learned today? Was there a concern you had carried for years that you now understand differently? And if you think another man over 50 could benefit from hearing this information, share the video with him. Sometimes the most helpful thing you can give another person is a conversation they were too embarrassed to start themselves. And if you found this information useful, please like the video, subscribe to the channel, and turn on notifications so you do not miss our future conversations about men's health, urology, vitality, and healthy aging. Remember, getting older is not the end of desire. It is not the end of dignity, and it certainly does not have to be the end of intimacy or freedom. With sensible choices, regular medical care, a healthy lifestyle, and a respectful understanding of your own body, you can continue protecting your health and confidence for many years to come. Take care of yourself. Listen to your body. Do not be afraid to ask questions. And never be ashamed of taking your health seriously. Stay healthy, stay strong, and I'll see you in the next video. Dr. Rose.